the healthcare system is, for the most part, a business. And as a business, profit is the major driver. And that's not necessarily a bad thing, but it is real. And I think there's a big difference between, the driver being profit and trying to deliver good quality care for that profit versus perhaps more what the profession of medicine was, and to some extent still is trying to deliver good quality of care and then make a living.
One of the key drivers that I'm experiencing in my leadership role, and I see us struggling with as a healthcare system, is really how we're growing. So we have a large academic health center. We are growing by absorbing community practices into our healthcare system. So we have, in primary care, we have dueling missions. We have an academic core focused on patient care and education and research. And we're growing in the community side where we have a variety of primary care physicians joining us from community practice who are really focused on the clinical care mission. I think the other key factor that I would highlight is really the conversion of a fee-for-service type payment structure to more of a capitated payment structure.
Great. So I think some of the major factors are cost, obviously, especially within the pandemic context, and then also accessibility to healthcare for everybody are two of the main drivers of health right now. I think in terms of insurance coverage as well.
And I think in rural areas where I am, lack of access to primary care and hospitals in rural areas is really going to be a big issue. In the last, I think, 10 years, there have been over 50 rural hospitals that have closed. And when the hospitals close, you have primary care physicians moving. There are fewer primary care physicians actually going into rural areas. And there are a number of primary care physicians like myself who are aging out, and there's nobody coming behind them.
We clearly do not have enough primary care in the United States, and that's complicated for a variety of reasons. That is a disparity that exists. I also think that we don't represent in primary care well enough the diversity that we see in our communities.
Well, the key factors driving healthcare, well, some of the most important are the social determinants of health, as they are directly affecting how populations manage their health risk and conditions.
So some of the things that I think I notice most often is from the patient care perspective is the need to understand the impact of chronic illness, and chronic illness not only on the patient, like in the physical and medical sense, but on the lifestyle that they hope for, on the goals and values and aspirations they have for what they would call a good life, as well as the relationships with their family and friends, and the impacts that those have.
So I think for me, an important dynamic that needs attending to in primary care is integrated teams, integrated healthcare teams. and what collaboration and decision-making looks like.
But if all we talk about is how they're going to take care of their diabetes and how they should not eat any sugar, when we don't assess that they're homeless, that they don't have any place to put the medication, that the medication gets stolen every time they leave the bag, then we're not really doing them any favor. We are just giving them tools that they cannot use. And that is why we feel that part of the healthcare should be taking measures to reimburse other members of the team that are not directly the doctor or the nurse practitioner, because they are also involved greatly into caring for these patients and helping them manage their condition.
I would say that in terms of things that might bring me joy or efforts that I think would improve kind of the well-being and the functioning of primary care is kind of allowing a space for wellness, and wellness that's not just in the space of preventive medicine, like people coming in for their checkups, but wellness within the scope of even like your mental health. Like you could have groups for coping skills.
What is the essential relationship that a medical clinician needs to have with the patient? What is that healing relationship? What are the traditional values? What are the traditional essentials of the clinician-patient relationship that must move forward as medical science moves forward? Really, I think we need to shift from problem-oriented care to goal-oriented care, and that's very different. Someone comes in, with a problem in the office, and you focus on that problem, and you may solve that problem, but that's not really what they were in the office for. What matters to the patient? What's their goals?
To answer the question about what family medicine needs, I'm going to steal a line from the infamous Simon Sinek, where he's very inspirational, and he says, we need to start taking care of the people who take care of the people. And I think this is really important for provider wellness, for staff wellness. And the data is there. The research shows depression, anxiety, burnout.
We are overregulated, overworked, underpaid, undervalued, and that takes a toll. And we have too many measures. There's just absolutely no way, and it's not that we don't want to, but there's just no way to provide preventative care, acute care, and chronic care in a healing relationship without more staff and more time to do it.
And I think another thing that really bothers me enough bothers me a lot is the failure of the electronic health records to produce what they all initially said that they were going to do. And probably the most important part of that is interoperability.
Creating offices that have the capacity for delivering care in unique and new ways, I think would be quite helpful. So that's going to maybe require having rooms that are fitted out with television monitors now, so we can do telehealth. And our telehealth encounter may be a behavioralist that's in another office, but that behavioralist is now joining us in our visit.
The other thing that I think worthwhile mentioning is social media. And I think it's beginning to start crafting a little bit of the opinions and the beliefs that maybe the consumer is starting to have about different organizations or different expectations from healthcare providers.